if we look at another group of women in the very same study who just got estrogen, women were protected from breast cancer on estrogen, which is literally the exact opposite of what we've been told for the last 20 years, what doctors have been taught for the last 20 years.
Welcome to the Inspired Living with Autoimmunity podcast, the podcast for high achievers who want to stay sharp, focused, and full of energy despite their diagnosis. With your host, National Board Certified Functional Medicine Health Coach, Julie Michelson, where Julie helps you take your power back from autoimmunity. And now here's your host, Julie Michelson.
Welcome back to the Inspired Living with Autoimmunity podcast. I'm your host, Julie Houghton, and today we are joined by return guest, Dr. Deb Matthew, America's Happy Hormones Doctor. She's a best-selling author, international speaker, educator, wife, and mom of 4 boys. After suffering for years with fatigue and irritability due to hormone imbalances, her quest to resolve her personal health led her to change everything about her practice of medicine. In today's episode, we are diving deeper into the safety of bioidentical hormone replacement therapy and the impact that hormone health can have on the immune system, as well as overall health span.
Deb, welcome to the podcast.
Thanks so much for having me back.
Welcome back to the podcast. Exactly. I am so excited for our conversation. It's been almost exactly 3 years since our last conversation. And life has definitely taken me in some different directions. But I'm so thrilled to have you back to share more of your wisdom with listeners, because I am so passionate about what you do. For those that didn't hear our previously recorded episode, which is episode 11, go back and check it out. Share a little bit of your journey, because I don't think, if I remember correctly, hormones were not at the forefront of your practice model when you first stepped through medical school, and you definitely weren't known as America's Happy Hormones Doctor.
Not at all. When I first graduated, I was a pediatrician, if you can believe that.
Wow.
But in my own life, I was going through my own stuff, as a lot of us in this field of medicine do. So I was tired all the time. Napping was my favorite hobby, and I would arrange my whole day to try to find a few minutes to be able to close my eyes. And I became anxious when I never was anxious before. I'd wake up in the middle of the night with these panic attacks for no reason. And I was so irritable. My emotions were all over the place. I remember one Christmas when I ran screaming out of the kitchen away from my husband and kids. I slammed the bedroom door, collapsed on the bed with ugly crying, like snot coming out of my nose, because we were having some friends come over for dinner, and I couldn't decide whether to serve mini egg rolls or pigs in a blanket.
Oh, well, that's,
Well,
life altering.
Yeah, he doesn't. My husband does not know what to do with me, and I'm so grateful that he's a patient man, because I didn't know what was going on with me either. It was so confusing because nothing in my medical training helped me understand what was happening to me. I knew it was not normal, but I didn't know what was going on. And what changed for me is that Christmas, he gave me a present, and it was a book that was written by Suzanne Somers about women's hormones. Because when he saw the back of the book and the little bullet points, and it's like, oh, this book, and I just looked at him like he was completely crazy, because medical doctors don't want to get their information from celebrities. And I said, like, you've got to be kidding me. But he said, we've got to do something.
Yeah.
So I read the book, and it changed my whole life, because when I read all these stories about these women who were just like me,
Right.
and how better they felt when they got their hormones back in balance, suddenly I understood what was going on. Like, I allowed me to open my mind, and I learned it's not woo-woo medicine. There's real science behind it.
Sure.
And there were links about where I could go to get trained. So I completely retired, and I retrained and reinvented myself. So back in 2007, I opened my practice because when I got my hormones balanced, I got my energy back. My kids got their mom back. My husband got his wife back. I got my life back, and I couldn't go back to just writing prescriptions all day long because that made no sense anymore. So now for almost 20 years, I've been helping men and women get their hormones back in balance so they can get well, get off a lot of those prescription drugs, and love the way they feel.
I love that, and I love that story, and I know my husband's mentioned in that book, so that's one of the reasons. But we clicked before I even knew that about you, and kudos to you too. You talk about is it so female? You think about like what your husband must have been feeling, and how out of it's also
Sure.
scary to have. I remember saying listeners know I had a hysterectomy with oophorectomy a little over 5 years ago now, and was being treated with hormone therapy, immediately. We were like, okay, we're in control. But I still, there had to have been, I must have had reserves,
Yeah.
and then all of a sudden they tanked. And so I just want to acknowledge how it feels from the inside too, to know, like, you're not the kind of person who needs to lose her stuff over what she's serving to friends, like, it's such a scary I did similar, panicked phone call, hysterical, was on my way to a training, and knowing what I had just recently had done, right? So I knew but even knowing what was going on, and I said, "How many women are being treated for mental health problems or getting labeled or diagnosed?" And it's hormones at the root
It's
of it.
such a big problem. And I think one of the challenges that we have is we know, like, if our periods are changing, if we have hot flashes, like, we kind of get that, oh, something's about our hormones.
Right.
But when your emotions are off, when your mood is all over, when your brain is not firing properly, you can't remember why you walked in the room and where you parked the car, and you got to write everything down, or you can't remember it, but then you can't remember where you put your note. It's not obvious that that's a hormone issue. We
Right.
sort of feel like we're crazy, we're lazy, we got early Alzheimer's, like,
Yeah.
we look for other explanations,
Yeah.
but sometimes it's just our hormones.
Yeah. And I want to acknowledge another for most of us when we go through whatever that challenge or challenges are that become created, it feels so lonely. And here,
Mhm.
like, think of it. Like, I want listeners, like, really take this in. This is a physician who wasn't trained in this in medical school and didn't know what was going on either.
Yeah.
And so, I can see this is why we have these conversations, right? Like, you're not alone. You're not crazy. It's you just need to find the right partner, right practitioner, right help and support.
I would love, if it's okay with you, to just share something that just happened to me, like, within the last couple of months,
Yeah.
it was a very I mean, in retrospect, it was a good experience to happen to me personally because it's gonna make me a better doctor, but
Want
I've been
those.
I've been on hormones, for quite a few years, almost 20 years, I guess, right? Since I started the practice. And what I've needed over time, of course, has changed, right? As I've gotten older. But my friend is a doctor in town, and she's been the one that's been writing the prescriptions for me. So I know what I need. I'm doing my labs and everything, and she's been very nice in looking after my prescriptions. Well, she's retired. And so I just went back to the same practice, and her replacement doctor was there, and she's got the records and all of that stuff. And I walked in the door, and I'm one of those patients. I ran out of everything. I'm just reaching into the last
Oh,
moment when I
yeah.
need my
Doctors
prescription.
are the
So,
worst patients.
but I'm there, and she asked me 3 questions. She said, um, "Do you wanna use the same pharmacy? Have you had your mammogram? And do you want a vaccine?" Like, whatever vaccine she was gonna offer me. And I said yes to the pharmacy. I don't know when I had my last mammogram. I think it's up to date, and no thanks on the vaccines. Well, apparently it was 18 months since I had a mammogram, so she refused to refill my hormones. And I know we're going to talk more about hormones, but one of the things that I think is so important for women to know is that hormones don't cause breast cancer. So by tying, like, gatekeeping access to hormones by my not being quite up to date on my mammogram, like, I sort of pushed back a little bit to say, like, seriously here, like,
I'll go and like talk to my
like,
friend Jen.
yeah. But, at no point in this very brief encounter was I asked, "How do you feel?
Right.
Are you sleeping? Are you having hot flashes?" There was nothing about me and how I felt. It was just, "You didn't get a mammogram, you can't have hormones." So, what's really notable to me is, I'm me, I know all about hormones, I know lots of other practitioners that I could go to. Instead, I just went out of convenience.
Right.
As I was driving home, I cried. And even now, I feel emotional about it because I felt dismissed. I felt unheard. I felt like she could have cared less about me. She just had to check all the boxes on her thing. Like the medical assistant ahead asked, "Do I have enough food to eat? Am I safe at home?" I understand why they have to ask all those questions, but nobody cared about me and how I felt. And it was so eye-opening to think that I know where I can go to get the hormones. It's not the end of the road for me, but for women who don't know what else they can do, that might have been the end of the road, just left, to go back to feeling how I felt before. So it was really eye-opening that there are so many barriers for women to be able to feel back to normal. Now, if I had been there to get an Ambien refill or a Zoloft refill or
Right.
control pill refill, right, it would have been fine.
Right. Yeah, like why are hormones optional? Again, you're practicing real medicine to empower women and men, empower people, right? Because none of us made ourselves sick or all the things, but we all have to be in charge of our own health, and so I think some of it comes from we live in this little bubble because I have these conversations and I'm at a functional medicine clinic and I'm it's like, oh, the world gets it. And we're working hard to change medicine. And it is really disheartening. But like you said, I'm sorry it happened to you, but I'm glad if it had to happen, it happened to you
Yeah.
because I know you're already treating your patients differently than that anyway, but there's more work for us to do. And there's a few threads of conversation I really want to touch on from there. Um, we're going to circle back to the breast cancer piece because it's big. And it's really, really important. And we just had this. I was just at a conference over the weekend, and we were having this conversation about why does misinformation stick so much better than actual data. But we're going to get to that one. I want to talk about because you just said something that's so important that I think is a different piece. Everybody should have in good medicine a provider who listens and asks and cares. And I believe when it comes to hormone health, like if somebody and I wasn't a physician and I wasn't in charge of kind of knowing what I needed. If somebody looked at my lab ranges, and labs are important, we follow labs. You don't do stuff without knowing where you are. Um, but what is your advice? And I really don't know, so it's a loaded question, kind of like you could surprise me if somebody's going for hormone replacement therapy and they're being treated solely off their lab results. Is that good hormone support?
No. First of all, there are lots of things that affect our hormones depending on what stage, in your life you are. If you're perimenopausal, your hormones are going up and down and all over the place. So whatever they are yesterday, they might be different next week, which doesn't mean we don't measure them. So this is the opposite is a lot of doctors won't measure hormones. And their explanation is that hormones change. So yes, over the menstrual cycle, they change. Some weeks they're higher, some weeks they're lower. And when you're in perimenopause, the years leading up to menopause, they're kind of all over the map, which is why we feel like our brain is all over the map.
Right.
But I don't believe that just because they're not consistently the same every day means we don't measure them. And I want to give a couple of examples. Your blood sugar changes depending on what you ate and how many just stuff you ate. We don't not measure it. We just give you instructions on here's what we want you to do and here's when we want you to measure it. Same thing with your blood pressure. If you're stressed out or scared or exercising, your blood pressure is going to go up. That's normal. But if you rush to the doctor's office, got caught in traffic, you're running late, you're just nervous because it's the doctor, your blood pressure might be higher. But we don't not measure it because it's variable. We just know, oh, maybe you're stressed. Why don't we wait 10 minutes? We'll check it again on your way out and see if it's gone down, or we'll have you come back another day, whatever it is. So we need to know how and when to do the tests in order to interpret them. And if you just happen to be at your doctor's office on some random Tuesday and you ask them to do your blood work, they often will say no because, they don't even really know where you are in your cycle and whether it's the right time. When you are on the other side, when your periods have stopped or you've had a hysterectomy or, you're not cycling anymore, then we can do the labs, anytime because it's going to be more consistent. The trickiest of all are women who still have their ovaries, but they don't have a period. Maybe they had a hysterectomy where their uterus was removed, but they still have their ovaries. Or maybe they had an ablation, which is they treat the lining of your uterus so you don't bleed anymore. Or some women have an IUD, which makes it so their periods stop. Their ovaries are still there. Their hormones are going up and down. We just have no idea where you are in your cycle, and that makes it trickier. So we can't just go by the labs because they're not going to, it still gives us information. It's just not perfect information. So no matter what the circumstances are, we always want to look at how you feel. And then we want to look at the test, and we need to put the two together. And if they match, great. And if they don't match, we're still going to lean more on how you feel, knowing that the lab tests aren't perfect.
Yeah, thank you so much for that. And we did talk a little bit about this. I think actually we were chatting about thyroid in that moment. This idea, this optimal versus in range, right? Like you can be in normal lab range, which is bell curve of a very sick population who wants that prize. And changes lab company to lab company, depending on what kind of patients they see. So I love that. That's where I get scared when people are like, well, my doctor said I'm in range. And it's like, but are you optimal? And how are your ratios?
Yeah.
I was in range my whole life, but I was estrogen dominant, but nobody
Yeah.
took that into account.
Thyroid is terrible for this in terms of
Same.
you have to be so far gone. I mean,
Yeah.
I normal and I felt terrible on the medication for 10 years because
Yeah. We
I've had
we had
photos.
that shared journey of
Yeah.
I had to beg and beg, and then they finally
Yeah.
threw Levo at me, and I was like, well, that
Yeah.
doesn't
Still
seem to
didn't
do
feel
anything.
yeah. But for your female hormones, it's kind of the same thing. What is normal? Um, there's this huge range, and what they're really looking for is tumors. Like, so
Right.
it's not looking for what is optimal and at what
For disease. Like,
healthy. It's looking for disease.
yeah.
And so you're almost guaranteed if you ask just sort of your regular gynecologist or your regular doctor who doesn't kind of specialize in this, if you ask them to measure your hormone levels, you're almost guaranteed that they're going to come back in the normal range because it's really, you don't have to be so extreme for it not to be. And typically the only test that they do for your hormone, for the women's hormones, is FSH, follicle stimulating hormone. It's a little bit like TSH for your thyroid, that goes opposite. If it's high, it means your ovaries aren't working that great. If it's low, it means things are going well. But that doesn't tell you anything about what your actual hormone levels are.
Right.
So it gives us a little bit of guidance, but it doesn't really help all the way.
Beautiful. And when you're talking to, and it doesn't matter if it's somebody like me who is, totally postmenopausal. I love, the definition of menopause too, because it's like a day.
Yeah.
And then you're peri for a long time. You're post. God willing, for a long time.
Yeah.
But what are so here's my other pet peeve, and I really would love to know your approach on, or want listeners to hear from you. This again, back to this idea of normal, because we only know like normal lab ranges, normal experience, but we only know what's typical or normal for us, right? So if I was somebody, I wasn't, thank goodness, but who had really painful, long, horrible cycle, had all of these complications, but I've had them really since I've been cycling. So no, it's normal. What do you
Yeah.
listen for when you're listening?
Yeah. I mean, what normal is you feel fine every day. Maybe you're a little more tired or moody one day before your period, and then have a normal period that doesn't really disrupt your day. It's a minor inconvenience, and then it goes away and you feel good. Like that's normal. So having days or like a whole week or a week and a half of feeling emotional and wanting to eat everything in the whole fridge and being, tired and bloaty and yucky. That's not normal. If your family feel like they have to walk on eggshells and they feel like hormone hostages for a week, a month, like that's not normal. And if your period is miserable and you're lying on the couch with a, heating pad and you're popping all the ibuprofen you can get your hands on, and it's like a, crime scene bleeding everywhere, and you have to like, that's not normal. And women's suffering like this, really, in medicine, we've done such a terrible job at looking after women. Can you imagine if men had to put up with laying on the couch with the heating pad and having all this bleeding to deal with? And
What had all this nailed
cramping?
down 100 years ago? Come on. There's no way.
Yeah, none of that's normal. And the other thing about all this kind of perimenopause and menopausal stuff is it kind of sneaks up on us. And so we don't really remember like where it started or how, we just know this is
Yeah.
how we feel now. And so especially in this perimenopausal time in our life, sort of anytime over 35 and getting towards menopause, when we're more irritable, when we're more anxious, when we don't have as much patience, libido goes down, we gain belly fat, we don't feel as good about ourselves. Like none of those things are good things. They affect our relationships. I mean, this is a time of a lot of divorces.
Yeah.
You know, honestly, sometimes we could be a little bit either hard to get along with or like not willing to put up with BS because we don't have the patience for it. It's also actually really sadly a time when suicides go up in women because our moods are, and then if we're given antidepressants, maybe they'll help a little bit, but they're not really treating the right problem.
Band-Aid.
They don't fix everything. And some women just, doesn't really help them at all. And then the side effects of the antidepressants is low libido and gain weight and right. That's not
Lower
a-
libido.
it's- well, yeah. So it's a really big deal. But what is normal is, how do you even define that? So the most common thing that I hear women say when they come in to see me is, I just don't feel like myself anymore. Like this is not me. This isn't normal. And one of my patients said, I just want Lori back. Like
Mhm. Yeah.
that's not so much to ask for. But if you walk into your doctor's office and you say, here's my laundry list of all the things that I'm feeling. This doesn't feel normal. I don't feel like myself anymore. What have they got to offer? Like they
Right.
don't anything really
The
except
antidepressant.
antidepressants.
Yep. That's what they grab for. Yeah. Yeah.
Because we weren't taught for the last 20 years how to deal with menopause. And let me just add one little tiny thing. You talked about like the definition of menopause is simply one day since your last period. So it's a one-day thing. And what I think women expect is, okay, so there's this perimenopausal time. I don't know that they realize it goes on for, so long.
It started
and
before they
early.
knew.
Yeah, yeah. But then menopause is just that one day. For the whole rest of your life, you will be postmenopausal. But what we think is menopause is this transition. It's a time frame, maybe a few months or, whatever. You just have to get through it and then it's over and you're out the other end.
Rainbow on the other side.
Yeah. And it's
Yeah.
true that for some women, they have some hot flashes that are worse initially and then they kind of fade. Sometimes they don't. The hot flashes can go on and on for years and a decade and more. But for a lot of women, it's worse and then it gets better. But the hot flashes might get better. The rest doesn't get better.
Yeah.
The vaginal dryness, the bone thinning, the inflammation that happens, the changes in our heart, like the aging
Brain.
process accelerates and our immune system function, all the rest of it. So menopause is not just a little thing that happens for a short period of time. This is the whole rest of your life we're talking about.
Yeah. Amen. I always say, because I'm not a doctor, so I get to like put things in like really silly terms. But I really do think of it as we enter menopause or near, the whole process, is just signaling to the body, like, you're done. Dry up, deteriorate, you're finished. I've actually seen clients that like, oh, well, I was on hormone replacement. They took me off when I retired. And I'm like, oh,
Yeah.
rude. Like, it's tied
To
to
the
to wellness and vitality,
Yeah.
right? And health span. And that's what we want to that's what we want. That's what we're going after here. I want to get to the breast cancer piece, but since we're talking about that, and it can be beautiful if you're supported, this transition from baby making and now I'm doing other things, right? Like
You don't have to worry about periods anymore. You don't have to worry about birth control.
it really can be like, I feel the best. I really felt bad in my 30s and 40s, but like my
Yeah.
50s have been amazing. And there's no way I would feel like this without support for sure, but it becomes, like you said, it's not something you think about. I have that advantage because I don't have my ovaries anymore, which was a personal choice due to genetics and, a lot went into it. Um, but I was like, and the extra gift was I didn't have to chase anything because I was already right on that cusp. And so I'm a little bit of a control freak, so I like that. But fluctuations, you mentioned, oh yeah, how about immunity, hormones and immunity? So tie for us a little bit, and it's a deep subject that I'm asking you to go lightly on. I want to remind listeners of this connection between hormones and autoimmunity.
Okay. We know that women are more likely to have autoimmune conditions than men. And the reason is that our hormones regulate many things, including our immune system. And so, because women have higher levels of estrogen than men, and because estrogen is so important at signaling for our immune system, the negative of that is that we are also at greater risk for autoimmune conditions. Um, but a lot of hormones impact our immune system. Cortisol, which is our main stress hormone, is one of the most important for regulating our immune system. Too much estrogen in some ways can shut down our immune system. In some ways it can speed it up because it regulates it. Not enough cortisol, like when we're burnt out and stressed out and overwhelmed, that leaves our immune system kind of in a free for all because it's not getting regulated anymore. And cortisol regulates all of our other hormones. So as women are going through perimenopause and menopause, when we have more stress and cortisol is out of whack because it's responding to our stress, it just makes us have more of our menopausal symptoms. But it also is creating more problems with our immune system function. So it can either trigger autoimmune conditions or we can have flare-ups and things can get worse. So stress and cortisol is a really important hormone that's regulating our immune system. Estrogen, though, is another really important one. Estrogen in women is generally anti-inflammatory, except just like cortisol, it can promote immune function or it can calm down immune function. It's regulating things. So when estrogen drops at menopause, we become much more inflamed. And so especially those 5 or 10 years after that one day in time of menopause, when our period's up, that is a very inflammatory time for women. And that's a time when we age at a faster rate during that time frame. Way back in the olden days, before we had medicines like prednisone and methotrexate and the things that we commonly use to treat autoimmune disorders now, way back in the olden days, we used to use estrogen to treat things like when younger women, they're not even menopausal yet, but they'd have things like rheumatoid arthritis. We would give them estrogen because it helped with their autoimmune symptoms. Another one is DHEA, dihydroepiandrosterone. So long we call it DHEA for short. That one is from your adrenal glands, like cortisol and adrenaline. But that's another one that regulates our immune system. And back in the olden days, before we had our new medicines, we used to give that one in order to help women who had autoimmune disorders. And women
We
who,
still do here, by
Yeah,
the way.
yeah.
Our
yeah, but even the medical doctors,
inflammatory. Yeah.
And, women who have to, or anybody who has to take prednisone or, steroid medications because of whatever health condition you have, that shuts down your adrenal glands. And your adrenal glands are supposed to be making this DHEA. So your cortisol is going to go down to the dirt. Your DHEA is going to go down to the dirt. And after menopause, after menopause, DHEA is the hormone that your body uses to make estrogen and testosterone, at least a little bit. And so if you be on prednisone and then, you go through menopause, you've got none of the raw ingredients to work with to make even the tiniest little drops of estrogen and testosterone. And testosterone is very powerfully anti-inflammatory. We know that people who have to be on opioid medications, and if you have to be on chronic pain medications for whatever your medical issue is, that shuts down testosterone. So we're giving you a pain medicine that inhibits the hormone that is anti-inflammatory. And so we kind of 2 steps forward, 1 step back. But women who are low in testosterone and low in thyroid tend to hurt more with the same amount of inflammation in their body. So whatever your arthritis is, or, whatever you've got that's causing pain, if you're low in these hormones, you will hurt more. And if we can replenish your hormones so that you're back to normal again, your immune system functions better, your pain tolerance, like the amount of pain you feel will go down. Your mood is better. Because when we get caught in not feeling good, in feeling exhausted, when we have more inflammation in our brain, it doesn't necessarily cause a headache. It can cause fatigue and lack of motivation and just loss of joy. And, you just kind of want to sit on the couch.
Yeah.
So all of those things are happening, and it just compounds however you're feeling from your chronic condition, or, whatever the end results are, the fatigue and all of that. It's everything is worse. And then we don't eat healthy because we don't feel good, and we don't go for a walk because we're exhausted, and everything goes downhill.
Spiral.
So
It's
absolutely. And so the simple thing of just restoring hormones can help pick us up to a place where now we feel better. So now we're much more likely to be able to take care of ourselves. We're much more likely not to need all the medications that we may be on that may be 2 steps forward, 1 step back. So to me, it's just such an important tool in our toolbox. And we'll have to talk about all the reasons why it's just so hard to get care. But for women who are afraid of hormones or feel like being on hormones is not the right thing, it's not the natural thing, you shouldn't do it, you should tough it out. An analogy that I love is wearing glasses. Like, I see you're wearing glasses.
yes, I am.
So as we get older, our vision changes, right? And now we have to stretch our arm a little farther to be able to see.
I ran out of arm. Yeah.
We don't tell women or men, we don't say, oh, I'm sorry, this is just a natural part of getting older. Your eyes just don't work as well anymore. You're just not going to be able to read, and you will no longer be a very productive member of society. That's not what we say. We say, yes, this is a natural part of getting older, happens to most of us. Here's some reading glasses so that you can just carry on and live your life. So hormones are kind of the same. Yes, it's natural. Yes, it happens to everybody. And there are some really negative consequences and long-term health risks that happen because of it. But what we can do is we can just replenish your hormones, get you back to normal again, and you can live your life.
Amen. And for back to the fear piece, do bioidentical hormones cause breast cancer? I'm just going to ask it straight out, and you can run with that ball.
Not only is the answer, no, they do not, but the answer is actually that they are beneficial if we're talking about breast cancer. So if we go all the way back, let's talk about this, because this is the biggest, most bad, terrible thing that doctors have done in all of modern,
And I feel like it's still a lot of women bump up against it still.
Yeah, absolutely. Okay. When I went to medical school in the 90s, we were taught that hormones were the greatest thing since sliced bread. We wanted everybody on hormones when they went through menopause because it was going to protect our heart, our brain, and our bones, and that was going to be a wonderful thing. The problem was, at that time, we were giving everybody the same pill. It was the same dose for everybody. Some it was too much and they didn't feel good. Some people it wasn't enough. So not everybody felt good and not everybody wanted to take it, but we thought it was the greatest thing since sliced bread. Then a huge study was done that was supposed to prove once and for all how it was the greatest thing. And they found that it was causing breast cancer. And overnight, hormones went from the greatest thing since sliced bread to bad, scary, dangerous, we're all going to die. And that's what you're talking about. That negative news has been so difficult to undo. But
And
here's
it's been medically
Yeah,
debunked for
absolutely.
so long now. But
what that study actually showed is that the women who were given estrogen with a synthetic kind of not real progesterone. Progesterone is the calming hormone that helps you sleep. So when I was irritable, screaming at my kids and having panic attacks in the middle of the night when I was 37, it was lack of progesterone. Okay, but so progesterone.
but you're not a horse.
I'm not a horse. So we were giving a drug that mimics that progesterone, but it's not the same thing. And we were giving estrogen from horses. That's not the same thing that human women have. So they weren't bioidentical. It wasn't the exact same as in our body, which is what bioidentical means. And even then, with those pills, there was less lung cancer, there was less colon cancer, there was less hip fractures. Women did better and they were less likely to die on the hormones than not. But there was a teeny tiny increase in the risk for breast cancer. If you didn't have any hormones, you had 4 out of 1,000 chance of breast cancer. And if you did have hormones, you had 5 out of 1,000.
And again, these were not bioidentical hormones.
Bioidentical
what we're
hormones.
talking about.
It also didn't meet statistical significance, which means, if you roll the dice a whole bunch of times, just by coincidence,
It'll even out.
or it could have come.
Yeah.
And in medicine, we argue all the time over what's right? The doctors can't all agree. There's nothing in all of medicine where we would have such a sea change of an opinion over something that might have just been by chance.
Yeah.
But nonetheless, women, we're all told hormones cause breast cancer. Now, if we look at another group of women in the very same study who just got estrogen, not only did they not have an increase in the risk for breast cancer, they had a 24% reduction in the chance of getting breast cancer and a 44% less chance of dying from breast cancer. So women were protected from breast cancer on estrogen, which is literally the exact opposite of what we've been told for the last 20 years, what doctors have been taught for the last 20 years. And I teach a lot of doctors how to prescribe bioidentical hormones. And they are still, even the doctors that want to learn and believe in it, are still scared that they're going to do something wrong and something bad is going to happen to women. It's like so bewildering at how it's been so difficult to change the minds of doctors. And in fairness to doctors, the very first thing that we do the very first day of medical school is we take this Hippocratic oath where we vow first do no harm. So we would literally rather do nothing than do something that might cause you harm. And we were terrified to think that we were giving all these women and we were doing harm, right? So,
but we just kind of went something similar to that, a bunch of, So,
like you said,
there have
been debunked.
Studies. There have been big studies since then.
All the main organizations, American Academy of Obstetrics and Gynecology, like all of the main organizations now say that the benefits of hormones to women far outweigh the risks for most women, especially if you're early on in your menopausal journey. So the organizations have changed their tune, but all the individual doctors are still so indoctrinated in the wrong thinking, which makes it very difficult for women because if you go in and you say, I'm not feeling good, I'd really like to try hormones, they're still to this day told, you're too young for hormones, you're too old for hormones. You're not a candidate for hormones because your mom had breast cancer. That's false. You're not a candidate for hormones because you have migraines and there's an increase in the risk for stroke and hormones increase your chance for a blood clot. Not true. We know how to give you hormones in a way that does not increase your risk for a blood clot. But there are just so many barriers to women. And the reason is that doctors are scared. So if you go to your doctor and you want to have this conversation and the doctor shuts you down and says no, what that means is not that you're not a candidate. It just means you've got the wrong doctor for this problem. Maybe they're a great doctor for a lot of other problems. Great doctor for this.
Yeah. Oh, so good. And I wanted to throw this in earlier when you were talking about one of the, I think, most fun and exciting things about I'm not a physician. I don't prescribe hormones, but we do at the clinic. And how quickly, so this is not, especially for those with autoimmunity or maybe multiple autoimmune or some other undiagnosed chronic suck, right? That they know something's wrong.
Yeah,
This is not, we're going to try this thing and in 6 months, we're going to know if it works.
right.
This is, I tease, right? Because the work I do with people, it take, first of all, I want them on hormones so they have the energy to make the changes, right? Like it, it, it is such a quick, immediate, and you can tweak and adjust and because many of us are changing, obviously my body isn't changing the amount of hormones it makes, but my stress levels may change, life
Yeah,
may
absolutely.
change.
Yeah,
Actually, post-COVID, all my hormones tanked.
yeah,
I was still using the same, and
yeah.
so the body really is always in flux and compensating. It's a balancing act. But for people that are thinking, "Oh my gosh, I've tried so many things," and you
Yeah.
know, this is like the body immediately will tell you, like, "Hey, right track." I joke, I'm like, "I will give somebody my wallet in a dark alley, no questions asked, but do not try to steal your hormones away
Yeah.
'cause I will fight."
Yeah. I mean, if it had not been for hormones, you and I would not be having this conversation because I wouldn't be doing what I do. I would not have opened my practice. I wouldn't have written my book. Like I've done so many things,
Yeah,
but I would still be laying on the couch, looking
me
at the
too.
laundry in the basket, waiting for it to fold
If
itself.
I were
And
even
it has
still
nothing.
here,
Yeah, nothing for
honestly,
me to give.
yeah. No, it's the depleted, and it doesn't need to be that
Yeah.
way.
That's a word that I use a lot, is you just feel depleted. So, like, yes, it's tired, but it's not even so much sleepy, it's depleted.
Yeah.
And then when you feel back to normal again, you feel resilient. You can handle your day and do the things. Like, those are not words that we kind of commonly use, but I think they really describe well, how it feels.
And we both do this for the same reason, so that we can all show up as our best selves, right? So we're all special. You're special. You're impacting so many lives, especially with the physician training. That butterfly effect is amazing. But this isn't just for a few people. Like anybody, this is one area across the board that can be supported in a safe, clinical way to help people. Again, it may be, it's not maybe, I mean, for my clients, it's a piece,
Yes.
right? But it is
Exactly.
such, and yes, I've worked with clients who don't, again, I respect, meet
Yeah.
people where they are. If somebody
Yeah.
is opposed, we educate and that's fine.
And it's nice that it's always a choice, but you should have choice, the choice with health. And I also think it's important to say that when your ovaries stop, at menopause, they stop producing these hormones. There's no herbs, there's no vitamin,
I
like
was
nothing.
asking you that. You
Yeah,
read my mind. There's
there's
not enough yams in the world.
no. So, like, they could take the edge off your symptoms, maybe, but
Sure.
they can't replenish your hormones. So they can't make you all the way. They can't protect your bones and your heart and your brain and your skin and your urinary tract. Because, even if you're fortunate enough that you're not having a lot of hot flashes and, you don't feel terrible, still changes are coming. And, I don't want to wear Depends. Like, I
That's
don't
how I
want to
get
break
my mom
my
to
hip.
use.
Yeah, like there's so much that's preventable. And especially for the urinary symptoms and the, painful sex and dryness and things like that. There's vaginal estrogen. There's different ways that we can do hormone. Not every person needs every hormone. It depends on you personally. So
Sure.
saying hormones or hormone replacement therapy as though it's one thing is terribly misleading.
Right.
Depending on you and your history, how you are feeling, what age you are, what other health conditions you have, what your risk factors are, we might not do it the same for everybody, but literally anybody can be a candidate at a bare minimum for vaginal hormones to prevent the dryness and the painful sex and the urinary symptoms and bladder leakage and urinary tract infections. Even women with breast cancer can be candidates for certain ways of doing hormone therapy. But it just requires a conversation, right? It might be for different people,
Yeah.
but you deserve to have the conversation and to be given the choices so that you can choose.
Amen. Well, I am sorry that you experienced what you experienced when you went in to get your refills. But hopefully it lit, kind of at least one more
Motivated.
ember. I mean, not that your fire has gone out at all, but that there's more work to do, and more people need the education, and more physicians need the education. So we're at that point, because I promised I wasn't going to keep you over, where I get to ask you for one step that listeners can take starting today to support their health. And it could be anything.
Um, I don't remember what I said last time. This might be the same one as last time, but this is my favorite one to say because it's easy. I'm looking for something easy that you can, do. And that is to get an oil change. So the different kinds of cooking oils that we use are either helpful for your immune system or not. And the seed oils, canola oil and things like that, corn oil, safflower oil, those ones are more inflammatory. Whereas olive oil, avocado oil, those are ones that are more anti-inflammatory. And that's easy because it's a one-time decision at the grocery store. Instead of picking up that bottle, pick this one. Now it's on your shelf, in your pantry. So whenever you need to cook, you'll just use the right oil. And so that's like a super easy thing that you can do. Makes your family healthier. They don't even know that they're healthier. They don't know the difference. So that's one of my favorites.
I love that one. That's not what you said. So even
Oh, good.
bonus, but sometimes we need to hear something again. But that this is actually gold. Like if somebody still has vegetable oil or corn oil or canola oil in their pantry, and like you said, the fun part, like I bake with avocado oil. Like you don't taste any difference.
Fine.
It's
Yeah.
just, why there's we go from inflammatory to actually anti-inflammatory and not even neutral, right? So
Right. Because if your immune system is misbehaving, and that's why you this podcast in the first place, right? I got my Hashimoto's and you but so doing the things that we can do to help our immune system calm down is really important.
I love that. You've already given us so much gold in episode 11 and in this episode. And I know listeners can get your book
Yeah.
just by going to.
isityourhormones.com. The book is called This Is Not Normal, A Busy Woman's Guide to Symptoms of Hormone Imbalance. And I wrote it because a lot of times women aren't sure. Are my symptoms because of my hormones? What I know. So it's got lots of checklists. So you can go down the list of, low testosterone or high cortisol and sort of see. There are tips for how you can get started naturally to kind of get your hormones back in balance. Tips on how to talk to your doctor about this. And also there's a couple of references for websites you can go to look for a doctor who could help you in your area. And the websites have doctors all over the world.
Amazing. And if people are leaning in because they're in love with you, which they should be, how do they find more of you?
So my website is signaturewellness.org. I'm in Charlotte, North Carolina. In order to be a patient of my practice, I have a whole team there. We need to see people in person at least one time, and then we can do telehealth. But people fly in from across the country to come and establish care.
Yeah. Good deal. And I say, go for it. If you're listening and you're in that really, really, really big population of people who have been discouraged or haven't had the right conversation with the right provider, check out Signature Wellness, find Deb, read the book. I just am so in love with what you're doing and so appreciate you taking the time to come back and give us even more.
Thank you so much. It was great. I'm glad to be here.
For everyone listening, remember you can get all those links and the transcripts and show notes by visiting inspiredliving.show. I hope you had a great time and enjoyed this episode as much as I did. I'll see you next week.
Thank you for listening to Julie Michelson's Inspired Living with Autoimmunity. Did you enjoy this episode? Please like, share, and subscribe wherever you listen to podcasts. If you'd like to get a transcript of this and every other episode, just head on over to inspiredliving.show or click on the link in this episode's description. There, you can also find everything we discussed in this episode, including links and information about our guest. You can even send in your questions to be answered by Julie in a future episode. That's inspiredliving.show. Until next time, this is Julie Michelson's Inspired Living with Autoimmunity podcast, helping you take your power back.